It's Osteopath Dr. Abbey talking about cervical osteoarthritis or neck arthritis. Osteoarthritis in the spine is also known as degenerative joint disease or spondylosis. In a healthy synovial joint, a protective cartilage lays over the bony surfaces to reduce friction and cushion the joint. With age, wear and tear, and trauma, this cartilage can start to degenerate and expose the bony surfaces to each other. This results in what can be painful bony changes within the joint. In the neck, this involves the facet joints and the intervertebral joints. Arthritis can be perceived as an old person's disease because by the age of 70, most people show some symptoms of osteoarthritis. It is important to note that young people can also be affected. Osteoarthritis is more common in females than males. Symptoms include a progressive onset of morning joint stiffness, aching joint pain, and reduced range of motion. You may be asking, what can I do to help myself? Things like application of ice, anti-inflammatory gel or heat, supplementation such as glucosamine, chondroitin, turmeric and fish oils, and gentle neck range of motion exercises. It's time to see a health professional if you're having trouble participating in your normal daily activities, or if your pain is getting more intense, frequent, or not improving. It's also important to seek professional help if you have neck pain associated with severe stiffness and high fever. There is no cure for osteoarthritis, but with appropriate long-term management, sufferers can maintain a relatively normal quality of life. Health professionals will use a series of questions, assessment, and provocative testing to see if you are suffering with osteoarthritis. If they have any further concerns, you may be sent for some further imaging. Health professionals will use a range of techniques in an attempt to improve or maintain your current range of motion, improve joint nutrition, and manage your pain levels. This will also be combined with tailored lifestyle advice, nutritional dietary advice, stretching, and exercises. This has been Dr. Abbey Davidson, Osteopath at Quay Health.